Couch. This is Brandon. I wanted to wish everybody a happy National Public Health Week. And so this is the Black Mental Wellness Lounge, and this is Future Black Voices, where we work with young professionals to give them tools and tricks and information and knowledge to help them on their professional journey. And so this one in particular, I wanted to talk about public health. I said when I started Future Black Voices, I wanted to focus on mental health, public health, and social work. And I've been neglecting public health for quite some time, and so I wanted to no better time than National Public Health Week to talk about public health. And so I wanted to link public health in with mental health to talk about how public health fits into mental health. And so I wanted to talk a little bit about my background, which is why I'm standing here and not seated where I normally am. But I wanted to talk about my journey in public health and how I've been able to combine public health into mental health. And so my master's degree is from Johns Hopkins University. We were just announced ranked as the #1 public health school in the country. So Johns Hopkins Bloomberg School of Public Health is where I got my master's of health science degree. And so as a part of that, my concentration was in mental health. And so what that department did is that it taught me how to do mental health research. It taught me how to look at population data and on mental health and figure out how do we impact individuals' mental health on a larger scale? How do we understand what's happening throughout the country, throughout the world, even in different regions, dealing with mental health outcomes? And so how do we impact those? And so my graduate certificate is in health education as well. I recently got my credential, my master certified health education specialist credential. So I'm excited to get to work with that. I'm going to save information about that for another video. So come back if you want to hear more about that credential. But I wanted to talk today about how, if you're interested in mental health and you don't want to be a clinician, you don't want to be a therapist, you don't want to be a counselor, you don't particularly want to do mental health research, where do you fit in? Like, how do you get into mental health? And so one piece of that and one avenue to do that is through public health. And so what is public health's role in mental health? How do we use public health skills in mental health? And so there are a number of ways to do it. One, public health helps you to understand what's happening on a population level. So it gives you information, tools, and skills to be able to understand, collect, and analyze data from a broad number of systems, to be able to understand what's happening with mental health throughout a specific region, throughout a community, throughout the country, throughout the world even. And so we're able to look at that data and pick out trends and understand what's happening. And then the goal is to figure out why, like what's driving some of these trends that we're seeing. And so the other part is that it helps give you information on how to implement interventions. So we have our research side that, does the work, does the randomized controlled trials, gets the empirical evidence. And, as it builds that up, as we formulate interventions, how do we practically get them to the people who need it in these different systems? I work particularly in suicide prevention for the U.S. Department of Health and Human Services. And so as a part of that, we have to take data that we get and look at it across systems. So we work with juvenile justice, we work with child welfare, we work with states and local organizations to talk about the data that they have and how can we use it to better impact those individuals within their systems. And so that's a big part of what we do and what we're able to do. And then figure out how we intervene. How do we implement something and get it to the people who need it the most to have behavior change, to have improved outcomes. And so public health also gives you the tools to be able to understand when there is improvement, to be able to do evaluation of large programs and of large interventions, to understand if these things are working, if these interventions are working. The other part about public health that I really love is that we talk about prevention, right? So everything is not about how do we intervene at this point. Things are already at this point. How do we move here? What public health does society impact versus mental health. And we talk about this more and more, especially as we work with, particularly, like I said, I work in schools. I do a ton of my work is focused and centered on the Black community, which is what drew me to do the Black Mental Wellness Lounge. And so what we do is that we look at the impacts of systemic racism. We look at the impacts of unfair housing. We look at the impacts of poverty and structural institutional racism. We look at microaggressions and how that impacts mental health. We look at the big picture. And it's so important in mental health to have tools to be able to work with an individual who's struggling, and also to be able to look at the grand picture to see what other